The cloud. All right, I'm recording. Okay. Ooh, my mask fell off. All right, so there's our groups. Yeah. So you fill in if you need to, or if you're missing. All right, so we don't have any. We can't have any. So degenerative nerve diseases is way too general. You have to pick one specific disease.
Or dementia.
Dementia is too general too, right? That's not a really disease. So I guess then just pick Huntington. So that's fine. If you wanna, then just pick Huntington's. That's why we're doing this. I wanna make sure everyone, it has to be specific, okay? All right, so we got diabetes. So Katie, Blossom, and Fabi, all you guys are on Zoom there. So diabetes, confirm that. Make sure we didn't change our mind. So unmute and confirm.
Yeah, we're doing that.
Yeah.
Yes, that's confirmed?
Yes.
Yes.
Okay. All right. Natasha. Oh, you guys are both here. Awesome. You guys confirm rheumatoid arthritis. All right. Oh wait, let's do this. How come you guys chose diabetes? Katie, that first group. Somebody tell me why. Was there a reason why, or just whatever? And oh, by the way, diabetes is also too general, I think. You need to choose one or the other, type 1 or type 2.
We were
Can we do both?
going to do both.
No, can't do both.
No. Can we do type 1 then, I guess?
Yeah.
Okay.
I mean, I guess, I don't know. Nobody else, I guess you could do both.
Okay.
That's fine. You could do both.
Okay.
Just make sure you're going to specifically talk about both types. You can't just, and make it specific that way. That's fine. But why'd you pick it? Any specific reason?
I forget who chose it. We were kind of just going back and forth with different ones and just picked one.
Okay. All right. Obviously, you're going to find lots and lots of information on that, right? For most of these anyway. All right, Natasha and Melanie, why'd you choose rheumatoid arthritis? Any specific reason?
I mean, I have arthritis.
You do?
Yeah. You weren't kidding.
What, just like not rheumatoid arthritis?
No, but I have regular arthritis.
Interesting.
I don't have arthritis. She's
Okay.
just so broken. Yeah.
All right.
And this, like, I wouldn't say family, I guess family friend I grew up with.
Yeah.
And I watched you progress.
Okay. Yeah, I mean, I think, all right, so usually there's like some reason why it shows what you chose, I guess. All right, so, look, oh, the camera doesn't like. Oh, who cares? All right. Mariano and Kenny, you guys chose Alzheimer's? You're confirming that?
Yeah.
Hello, anyone? How come you chose Alzheimer's? So if you don't have a good reason why you chose it, then you gotta tell me something about it. How about that? Kenny or Mariano, either one of you, somebody.
I mean,
wait. Okay. My mic was muted on my side. I was talking to a wall. I found it very interesting overall how it affected so many people, and like a lot of times, they say it's connected to like the nerves deteriorating, but I want to know like how and get into the flow of like how people get it or what makes the people like get it faster than usual.
Okay.
So I want to see if like there's early cases of Alzheimer's and not only just when it's like in the future and when people are older.
You mean early onset, meaning younger age of onset? All right, well then you should look, your journal article that you are gonna look for this first assignment should be related to that then.
Okay.
Look for early onset or something like that. So the reason why I'm doing this is because we have to think about things that are specific, right? Like when you're looking for this journal article, like find something specific, that's focused, and then you're gonna present that. So you're not gonna be able to, tell us every single thing about it, right? But you gotta kind of pick something that's sort of interesting, some aspect of it. All right, so that was a good example. All right, Claudia Berlin, what Crab disease? What's that?
All right, so we chose Crab disease because it affects like young children, mainly babies, before they turn 6 months, and it's like an inherited disorder that destroys like the nervous system of babies. So like mainly like,
okay, so hopefully again you want to make sure that I guess you have to make sure that you have there's enough information there to like complete the objectives of the poster. So you guys will look into it a little bit more and just see. Remember, I kind of said this, like you may find that like you start trying to find articles and stuff like that, and it's just maybe not the right topic for this project. So, but as long as there's enough information out there, then you should be fine. I don't know a lot about it, so. All right, cool. Marianne, so we said, okay, Huntington's, yeah? That's your specific choice there. So what do you know about Huntington's?
I'm just like I'm into neurological disorders, so I thought that would be.
All right, so it's a neurological disorder, but what else is it? What other kind of disorder is it? We talked about it in chapter 2, which was our genetics chapter, correct? Right? So it's a genetic disorder. All right, cool. I like that topic, obviously. All right, Rachel, Chrysanta, and Maria, that's your group there? Somebody speak up and tell us why you chose Addison's disease. What is it? Chrysanta, how come you chose Addison's?
Huh?
What do you know about Addison's?
So like I saw that like it actually affects like the cortisol and like the adrenaline. So since we were talking about that in our last lecture, so I just thought it would be like kind of cool to do a disease that kind of affects that.
Okay,
and then
yeah.
Go
ahead.
Huh?
Go ahead.
Oh, and then like some of like the symptoms, like it affects like the color of your skin, so like it makes your skin kind of look bronze. And then it affects the GI tract and weight loss and a lot of other things. So I feel like that was like a nice disease that we could get a lot of info on. So
also affects like water salt balance as well, right?
Mm-hmm.
Yeah, there's a lot of effects of that. All right, cool. That's a good one. So that's like an endocrine disease, I guess you would consider it. All right, Annabelle, Casey, and Erica, you're choosing syphilis. So why?
Yeah, I had thought about syphilis because like I previously had heard about this before because I had to do an infograph on this, and I found it interesting how the bacteria spreads through the body. It goes in different phases, so it's not like you just get it and then it's just the same symptoms all the time. It goes through 3 different phases throughout the whole. So I found that to be interesting.
Okay. All right, cool. So even like just by looking at your guys' topics, right, we have a pretty good variety. I mean, it always just kind of works out that way just based on interest, right? We got some genetic diseases, we got some neurological / genetic diseases, and just a neurodegenerative disease there. Also an autoimmune disease, right? And diabetes could be is part of it, autoimmune. And then so anyway, we have a lot of variety, so that's good. All right, so we got Juliana and Carolee. What do you guys got there? It has to be a disease. That's not a disease.
Isn't that like a type of heart disease though?
But that term right there is not a disease. So you have to pick a specific disease that maybe that's a symptom of.
All right.
So I'm gonna probably break you guys. I'll probably let you guys work on this a little bit just so I can sort of make sure we find a journal article because that's due. I have that due Friday, right? In 2 days? Yeah. So you guys can think about this and research a little bit more. So what I'm gonna do, I guess, or what we can do right now since we're on this, since switching topics and going back to this, I want you guys, you need to find a journal article. Each person does. Now, I can break you guys up on Zoom into breakout rooms, or you guys can just FaceTime each other or something like that. I don't know. How do you guys want to do this? Can we all get in contact with our group members on our own right now?
Yes.
Yeah? If somebody has an issue, let me know. Chrysanta, can you call or FaceTime? Who's that? Maria and Rachel? Yeah, so, yeah. All right, so everyone get in contact with their group right now. And I'm gonna kind of go over to each one of you and whatever, talk through the speaker, I guess, for each one of you kind of separately. That's the only thing you're gonna hear all of our conversations, but I don't know. It doesn't really matter because I'm not gonna be able to really do breakout rooms anyway because we have half in and half out. All right, so I'm just gonna go in order as listed there, okay? So you guys can kind of, so start talking to each other, try to ignore me, I guess, and think about, let's just focus on finding some journal article, right, some literature. And you know what, I guess I'll kind of like, I can pull up PubMed on the screen and kind of help you guys with that, okay? All right, you guys got that? So everyone should be looking for a journal article. So going through PubMed and pulling up, each student pulls up one journal article. It can be a review article. One person could have a review article. One person could have a original article. But eventually, for this assignment, okay? Eventually, though, guys, you're going to have, so wait, let me just show you one other thing. So everyone just pay attention 1 second. I forgot. Let me show you something. This will probably help a little bit. Let me just show you one other thing that I did on Moodle, okay? So as you guys are kind of assembling yourselves, I added some more information. I told you I was going to clean up some of that presentation information. I did add that on to Moodle. So there is, oops, let me show you. Let me share my screen and show you guys where it is, okay? Just so you know. All right, so it's right here, right? So in this week, there is a folder for final poster presentation information. This has the info on it and the rubric. And then there's, remember I told you I was gonna take one of those posters and kind of just break it up to make it a template. You guys can use that, so I'll show you that in a second too. And then there's 2 sample posters there. Those are just student research posters, okay? Just so like you can kind of see, I don't even like for design or whatever. Okay, so now I have to fix my share. It's just easier if I just share the whole screen. Okay, so if you guys take a look at this, this is the information document that's there. We kind of went over it already, so I'm not gonna really like go over it, but take a look at this as you guys are in your groups, okay? So what we're, you know, obviously you're gonna have to get information for kind of this part 1, right? What's the disease, general prevalence, that kind of stuff. That kind of information you probably can pull from a journal article. I mean, from a review article, right? Or something. That's probably the best way. But when you're gonna, and maybe even for section 2, that can probably come from a review article, that's fine. You can also use a textbook, okay? But we can't use Wikipedia and things like that. But for that section, oh, the other thing I have to tell you too is how many articles you need. For citations or references. Sorry, I knew at least 4, okay? At least 4, I guess I'll call them references. From primary literature, right? Like I said, you can use the textbook or whatever. Obviously, you can use other sources just to kind of get a general idea. But when you're really pulling that information, we want to try to pull it from primary sources, okay? So, primary literature. Okay, sorry, okay? So, review article. But when you guys get to the new discovery/research section 3, this has to be like an original research article, right? You find an article that's like testing some new treatment, say, for, you know, Huntington's or something like that, right? Or a study that identified some new gene marker or something like that, okay? That's what we're trying to get at for that part, okay? And so each individual student for this section 3 will have an article that they kind of put on that poster and present when you do the presentation. You guys got that, right? Does that make sense? So maybe right now you might want to just find an article, like your article that you're thinking you might want to use for this section, guys. Okay, so that we can kind of be focused, if that makes sense, right? So find something about your disease that's interesting, right? Whether it's on the research, the basic science front, right? In terms of like I said, identifying a gene or a SNP that's associated with it, or it's about treatment, whatever it's about, you want to find something new, okay? Or newer. So we don't want to find a paper from like 1970, like when, Huntington's was discovered. I don't know when it was discovered, okay? That's not what it's about. We want to present this poster with some, new information on it. All right, you guys all right with that? So let's look for an article for that part, for section 3, okay? You guys got that on Zoom? We're gonna look for an article on section 3. All right, and I'm gonna check in with you guys, so make sure you're like around. I'll check in with each group to see kind of what's going on and where we're at, all right? We're gonna probably only spend, I don't know, another 20 minutes or so on this. I don't wanna spend too much time, but I wanna get you guys going. All right, so like I said, I'll kind of visit everyone or talk to everyone in order that's listed on our Google Doc.
Do you have access to not free articles?
I do have access to not free articles. However, it's better. I mean, so the answer is yes. Can I pull them right now? Potentially.
She really asked me because I found an article and that's about updated treatments on Huntington's disease.
Mm-hmm. It's a review?
Yeah, it's just not.
Yeah. Just email me the citation. How about that? Yeah, so remember, it's best to, use PubMed and put that filter on that says free articles, right? Free to me or whatever. But with that said, if you find one that you think is going to be really helpful, I usually can get it for you, okay? And then in that case, just email me and I'll let you know if I can get it. So let's do this. Oh my God.
So we're only gonna see the abstract because like when I go and click on.
That's why you have to choose, yeah. So that's why you need to choose articles that are free to you so you can see the whole article.
Yeah, I did that. Every one that I click on, I did the how you filtered it with the free full text in the review, and every time I click on something, it just shows the abstract. And
well, then there's usually a link. I'll show you. There's a link. If it said free full text, then there's a link for full text. The abstract's not going to help you. I mean, it'll help you screen through. But here, I'm going to pull it up right now, Erica. Okay.
Okay.
You probably want to keep it within 5 years. Maybe for kind of like some of the review, well, even for the review article to pull prevalence and stuff like that, we want recent, right? Prevalence. So everything needs to be within 5 years, guys. So here, look, Erica, do you see my screen? If I click free full text there, right? And you click on this, okay, it's going to show you the abstract, but then there is always a link here. So you'll see where it says full text links. Click that, and it's different on different sources, right? So sometimes on the top left, but sometimes it's there. Here, and then see PDF.
Oh, okay, I see it.
So you can so that's here. You can, the full text version, not the PDF, is better for pulling figures and stuff in to your poster, just so you know, right? So you can actually do that and then copy paste stuff in, okay? All right, does that help you?
Yes, thank you.
I think that's the way you spell the gene. Yeah, that's the way the gene is spelled. When you refer to the gene. All right, let me go back to our Google Doc. All right, so Katie, Blossom, and Fabi, why don't the three of you guys unmute yourself and tell me kind of where you're at and what you found. And if somebody needs to share their screen with me, they can.
So I found an article, let me pull it up.
Yeah, share your screen if you can. That's probably the easiest way so I can take a look at the article, or let me know if you need help finding something. That's the whole point of doing this. This is the worst way this camera is positioned. It's like on my stomach. Thank you.
Can you see it? I'm not sure if it worked.
Show me the article, Katie.
Oh, the actual article.
Yeah. She already did it. Right? So you want to, just like Katie's showing you guys, you want to do your, the assignment for Friday is just to summarize the article and also to upload the full PDF, not just the abstract. I need to see the full PDF. All right, so here's your article here. Go to the title. Let me just see the. Okay, so what kind of information are you pulling from this article, Katie?
It was about the different growth in children and adolescents diagnosed with type 1 diabetes at different ages, and what hormones and everything are affected.
Okay, so is this a review? I mean, so again, if you look at the journal too, right, guys, it's a public health journal. So obviously this is probably giving you more epidemiological type data, right? Is that what it was doing?
Yeah, more so, yeah.
Okay, which is fine because you're going to need some of that information as well. But Katie, this wouldn't be an article that you could use for like that part where you're talking about new discoveries, right? Okay. Just so you know, but this is still an article you probably want to use to get some information from. That's fine.
Okay.
But it probably doesn't fit into that kind of category. You know what I mean?
Okay, yeah.
So you don't have to redo your assignment or anything like that. It's fine. But just think about kind of another kind of article too to look for. What about, who else is it? Blossom?
I'm here, yeah.
Fabi?
I'm Blossom.
Did you find one yet, Fabi?
Yeah, I saw the, let me check it. This is what I saw. It's just in general information about type 1 diabetes in adults.
Right. So let's try to focus and look for just an original research article that's going to help us with that last section. Now, from this, you could probably find a study that they talk about, and this is a little old too, Fabi. So,
yeah, 2014.
Yeah. So keep looking. Look for a more recent article. And even if it's a more recent review, you can then look to see if they describe a study. You can then go and pull that study or something like that. But again, you probably can get some information from this, which is fine. But it's not gonna satisfy that section on the original research kind of thing. Okay. New discoveries, right?
Yeah.
All right. Who's your other group member? Blossom?
She said that she keeps getting kicked out of the Zoom. I think her Wi-Fi is acting up or something.
All right. Thanks.
And I had already like obviously cleaned out of everything.
اما تغيروا لك اياها هذه المشكلة.
شمي؟
All right, I'm checking on some of these guys over here. How are you guys doing?
This kind of good one. Okay. This one was hot. She just shared it with me. I just shared it with them.
Okay. So yeah, that's good for like getting general, definitely probably good for getting general information, right? And in terms of like cost too, right? Remember that part of it? So yeah. All right. Look for, and if you use that for this assignment, like that's due Friday, that's fine, right? Like even if what you find right now maybe isn't gonna fit into that new discoveries thing right now, it's okay. But you want to try to look for something that's going to fit in there. But you might be able to also from this, like read about other people's work, and then you could then say, all right, I like, you know, this study that they described here, I think is interesting, right? And then you can look at their references and be like, all right, I'm gonna go look at that article. Does that make sense? Yeah. So that's why I always tell you guys, start with like a review. It kind of helps you focus. Okay. All right, what else? Did you find one?
I mean, I don't know if this one would be one, but it says placebo responses and I can't even say it.
Oh, okay. Well, so that's interesting because that's like clinical trials. So, okay, what year is that published? 2019. Okay, so it's new. So yeah, even if that's a review, read through that because they may refer to some other things. So that could be interesting. Okay. Yeah. All right, cool. Yeah, no, you really? No, I'm kidding. I'm good. Mariano and Kenny, what did you guys find so far?
What I found was they're trying to find if it's possible to make a vaccine for Alzheimer's.
Well, I don't know about that. That's not.
I know.
An infectious disease.
Well, you said related to like new discoveries for Alzheimer's, so I was just like, oh, okay.
All right. Well, okay. Well, did you find something that suggests that?
Yeah, it's an article on PubMed.
Can you share your screen and show it?
Yeah, sure.
I wanted. I'm like, no, I got mine.
What
What happened there, Eric? On my laptop. My friends. Yeah.
Let's see. And they were talking about it here.
Yeah, so that's not really a scientific article, right?
Oh, okay.
So just beware of things like that. I mean, maybe you might get some ideas in there, and they may cite some other things that you could look at, but that itself is probably, that's like an opinion sort of piece. But it's okay to read some of those, but then you're going to have to sort through and find, you know, additional info.
Okay, well, I'll be looking through this again.
All right, go ahead, keep looking. You're good. Kenny, what'd you find? Thanks.
I've just been looking at like types of combination therapies for Alzheimer's disease.
Okay. All right, that's fine. So you're kind of thinking about focusing or looking at information on treatment.
Yeah.
You'll find a lot. Yeah. There's a lot of things with Alzheimer's. Yeah. Even with animal models of Alzheimer's, yes, treatments, in terms of like trying to develop new treatments, all of mostly of which have been unsuccessful. But yeah, you can find a lot on treatment. That's probably a good route. All right.
Yeah.
All right, cool. All right, let's see what else. Who else? All right, Claudia and Berlin. Tell me what you found.
Hi. How do I share?
One of you guys can share your screen and just show me what you found. Oh, is Claudia not here? Where is she? Oh, there you are. I see you. Sorry. You are there. So why don't you guys share your screen and show me what you found on this disease.
Okay, I found treatment for Crab disease, finding the combination. So I'm like trying to share, but I don't know how to work this.
So again, I added this to the guidelines. All of your articles need to be within the last 5 years. That's another criteria.
This is 2017 of November 1st.
Okay, so you're cool. Within 5 years is our limit.
But I remember one time from PubMed, she was like, all your articles have to be from like this year. And my shit was like from 1980 by accident.
We can hear you, Mariano.
Yeah, I know, man.
Okay, I'm just making sure you know. That's like my worst fear. I'm like screaming at my son, and then I'm on. That was me the other day. Oh my God, I'm screaming at him. I'm like, oh, is everything muted?
One of your videos, like you already hear the
Always. Oh my God. I'm hungry.
Yeah, because you'll be on lunchtime.
Oh, on the recording, you mean? Oh my goodness.
And it's really only like 11:30. I'm like,
No, but their lunch break is like 11:45. So, and then they only have like half an hour. So he's like, what are we gonna have for lunch? I'm like, I don't know. I don't have time to. Oh, the dog. Oh, yeah. The dog's annoying. Everyone's annoying.
Doctor?
Yeah.
I'm sharing my screen.
All right, cool. I see that. All right, that looks like definitely a good start. So that's a review, right? But you should be able to find more information and other kind of articles from this review. So that's definitely a good place to start.
Okay. Thank you.
Oh, leukodystrophy. Is that another name for it? Ah. All right. So this is going to probably give you a lot of information on causes, right? The actual mechanism of what's causing the disease, right? Those are the two big things we're focusing on. New research and what exactly is happening biologically to lead to those symptoms. All right. Okay, what else we got? All right, how are we doing? Huntington's. You have minimal on. What do you guys find? Yeah, if you really feel like you really want that article, then email me the citation. Yeah, that's what you can email. Yeah. Oh yeah, update on treatment. Okay. You said the last 4 years? Last 5. So what does that mean? Going back to 2015? Yeah. Yep. We could go back to 2015. Okay. So this is going to give you probably a lot of information on causes and mechanisms, right? This was that's another review there. That's probably super helpful. Did you get that one? Yeah. Same thing, that's going to help treatment and stuff like that. So here's that. Oh, that's cool. But it still might be helpful to read it, right? But yeah, you know what I mean? But for that, right, for the actual like articles that you're going to present, like saying, hey, here's a new kind of or something like that, we want that. But it's okay to find some older stuff that helps you understand it. You know what I mean? You could still use it as one of your references, but those research articles that you're presenting in that discoveries or evidence-based research place that needs to be new. 2015. Oh, I can hear you. Go ahead. No, as a group. Okay. That's easy. Yeah. Sorry. I guess I shouldn't. We're gonna need. She said as a group we're gonna need 4. All right, that's pretty cool. I agree. Great. Yeah, and this is the type of disease where they're actually looking, I don't know if I changed editing type of technology. Alright, so anyway, it's probably not, but it's a sort of drug that's money, yeah, to try to interfere with target more prescription, right? Target the yeah, I read that. Good. That's fine. Look, this one's about. So this means biomarker. Yeah, so that definitely is a good one for that diagnosis section, right? Because it's a way of treating. Yeah, Huntington's is interesting, right? The discovery of non-target biomarkers using you're fine until like age 40 or something like that, and then you start to develop. Oh, this one definitely. This one talks about the voice test. Okay, cool. And like what the exact okay, put that in the document and then we'll review. Okay. You guys got a plan. It's pretty easy to work in groups, electronic version, right? Mine's your FaceTime, huh? Oh, that's FaceTime. Okay. I was waiting for your FaceTime, huh? I really did. Did you find one, Emma? Yeah, we emailed like the link to Marianne. Okay.
Would this one be a good one about like discoveries, how they made a test to see the early like diagnosis of it?
Yeah, what are you guys saying? You know what I mean?
Yeah.
So, same thing. So that's good because that brings up kind of like another implication, right? Like you can think of like studies that look at treatments, right, whatever, causes, but then also diagnostic tests. So yeah, I think that's a good one. I like it. Yeah, so you guys are just, combing through here and seeing what you want to kind of focus on. You're not
The
gonna
current
obviously
study
go to
aims to identify
talk about
whether
everything.
provided diagnostic biomarkers by using a proteomics. Are we? I don't know. No, this was weird. All right, I'm gonna put this one just in case.
Yeah. All right, what do you got here? Oh, oxidative stress.
Right.
We're talking about that in chapter 5. All right, that looks, so again, okay, so that's 2015, kind of on the older end, but I think, that'll help you get some more information about that topic, right, oxidative stress, then you may be able to even find newer articles related to that, right, and it probably will help you understand. Yeah, well, that, or you're looking for your article that you're going to end up presenting in the new discoveries kind of part of it, too. So, I kind of said to focus on that, but it's either or. I mean, you're gonna kind of need both types of information. Oh yeah, so what's that one? Okay, so that one's a little new. Okay, yeah, it's the same thing. This is like a little mini review, which is definitely good. It's a good place to start. But then if you then, Manuel, are going to focus on this, like for your article, right, for that kind of, whatever I put at section 3 or whatever, then you're going to need to find probably a more specific article that just focuses on, like, here's our research, here's what we did. You know what I mean? And you may find that there because they may review somebody's work that you can then go look at. Yeah? Right, I was looking into the references for a lot of other articles. And the other thing is too, like if this is a little bit older, right, and you find an older reference, what you also can do is search that author, right, and see what they have new out. That's another way of kind of like without searching blindly, kind of, you know what I mean? Mm-hmm. Okay, so that's helpful. Okay. All right, sounds good. So you guys, so that was like, what you had, Marianne, and what Manuel was looking for, 2 totally different.
Yeah. Things.
Things, right? 2 totally different aspects, and that's the idea, right? Okay. Good. I think you guys are off to a good start. All right, let me check with Annabelle. Annabelle, Casey, and Erica. What do you guys got?
I found an article. Well, I found 2 articles actually. One on the evolution of treatment for syphilis, and then I found one on the treatment of syphilis. But
okay,
one of them is in Spanish. But I feel like that would have been a good article. And I don't know. Every time I try to switch over to English, it just changes the abstract to English, and the rest of it is in Spanish.
Oh, in Spanish.
So
all
yeah,
right,
I'll probably not be able to use that one.
All right.
But,
Annabelle, what did you find?
I found 2 different articles kind of over 2 different things. One is like looking at the pathology of syphilis and how it's kind of similar, I guess, to leprosy, and how they think a vaccine for leprosy could help prevent syphilis.
That's interesting.
But it's from 2011 and 2013, so I don't know. I guess that's too old.
Well, but you may be able to find, like, by reading through that or combing through that, you may be able to still find, something in there that you then can search to find newer stuff. Or even if they're citing an article from a group of researchers, right, that's older, just then search their names again and see what they have more recent work. You know what I mean? That's a way of kind of like, but that's interesting. I think for the newer articles, I definitely want you to find newer for that section on the new discoveries. But if you're using an older article for some other kind of information that you're putting on there, I think that's okay. Do you know what I mean? But we want to make sure at least those 3 in the new discoveries are recent, okay?
Okay, I'll look that up.
Yeah, that might help. All right. Who else? Casey? What'd you find?
I found one about extensive bone defects caused by syphilis.
Okay, that's interesting. All right. Is it newer?
Yeah, it's from 2018.
Okay. Now, again, if we're thinking of kind of like the new discovery sort of evidence-based practice, I mean, I guess that kind of fits in there, right? Because it's some other new symptom or something that you need to be aware of. But then you want to, I guess if you're going to go that route, you got to talk about kind of like why, how is that happening, right? Like kind of like what's the mechanism kind of thing.
Yeah.
You know what I mean?
I also found one where it where it was like linking syphilis and schizophrenia too.
Okay, interesting. All right. Okay. All right. Those are two, I think, kind of interesting topics. All right. Cool. All right. Let me see. Juliana and Carolee, what'd you find? You got to modify that topic.
So I think we're gonna switch, and I think we're gonna do a muscular dystrophy.
Okay, so
No,
same
but like we're
thing.
gonna do
You
a
got to choose a
specific one.
specific one. Specific
Yeah,
one?
we're gonna do. I think it's Duchenne or something.
Okay,
I don't know how to
Duchenne is
pronounce
fine.
it.
Duchenne.
Yeah.
Okay.
And I
So
found
write that
an
down
article.
on the Google Doc. Add that's your topic, so I know what everyone's topic is. Duchenne muscular
Okay.
dystrophy. That's cool.
Okay.
All right. What'd you find?
I found an article that was published on the 15th of this month. That they're like trying to find a new way to treat it.
Okay. All right. Cool. Carolee, what'd you find on that?
I'm still looking for articles since we just switched it.
Okay. All right. Yep, that works. So switch that topic. All right, I got one more group to talk to, and then we're gonna be done. So just kind of like get yourselves up to a point where you guys can each work on something separately, and then that way you guys can kind of. I guess right now, what you need to know is your journal article that you're gonna write your summary for, which is due on Friday, right? So make sure that that's set. If you have questions, let me know. I'm just gonna go check on one more group, okay? But I want everyone to be at a point where they have one article that they're gonna read, write a summary for, and upload for Friday, okay? All right, let me go check with, who else I can check with? Oh, Chrysanta, yeah, Rachel, Chrysanta, and Maria. I guess I can stay right here. Rachel and Maria, what did you guys find? Then I'll go bring Chrysanta back. She's in the hallway.
So by Friday, we're supposed to review and do the summary on this article.
Just one article that you found, yeah, yeah. All right, what do you got there, Rachel? What'd you find? Maria, what'd you find?
Oh, yeah.
Damn.
Maria, what'd you find? Did you find an article?
Most of these two are around here.
Everybody should be here, to be honest. Where's your drawing? I don't do it.
She just do that.
Girl. So you get 50 points logged in.
Girl.
All right, so what'd you guys, Chrysanta, what'd you guys find? Again. What'd you guys decide? Did you find an article or did you Okay, okay. So you each need to find your own article, remember? Okay. Okay, but now you each need to find your own because there's an assignment that's due Friday, right? So I want to make sure you guys are all okay for that, right? And what you do your journal article, summary on Friday, if you end up not using that article, it's okay. So Rachel, did you find an article that you can share? Is she there? No, she isn't here. She might have stepped away from the
We
computer.
did find articles.
What'd you find? Just, well, so who, Maria and Rachel, can one of you guys share the article that you found? Each one of you has to find your own.
Hello, can you hear me?
Yeah.
Okay. Oh my god.
You probably should shut that off.
Okay, I just found that Addison's disease is like the most common cause is autoimmune adrenalitis. And then I also found like different treatments for people that are diagnosed with this disease and
Okay,
people
but
that are.
what article did you find? Each one of you has to find your own article, right? And we're trying to focus on something that's like a new treatment or something newer that we learned about that for this. Remember, guys, for this part of the, 1 second, let me share my screen. Right? For, oops, did I do the wrong thing? No. Okay, so for this section 3, this is what I'm trying to, I mean, again, if you found an article that doesn't really fit into section 3, it's okay, but that's kind of what we were doing, right? So each student's gonna have to find an article for this section. So it has to be something, you know, new, right? Something new that was discovered, a new gene target, a new treatment, a new diagnostic tool, something like that. You want to find an article about that. So did you guys find anything yet like that? So you guys should be on PubMed. Go ahead.
Oh, okay. Well, I didn't use PubMed, but okay, from what I got from this website, I just found that they use thyroid hormone therapy for people that are undiagnosed with Addison's disease.
Okay, so then now you need to take that information and put it into PubMed and actually find primary literature on it, right?
Okay, yeah.
Okay?
Right.
So it's fine to start like there, but now you have to go to the primary literature, okay?
Okay.
All right? All right, Rachel, do you want to add anything? Cassandra, do you want to add anything? Or you're all right, or you didn't look on PubMed yet, or you did?
She had an article.
Yeah, I didn't look on it yet, but I think you might like after everybody else.
Okay. All right, so just make sure you guys are looking for an article. If you find an article, you haven't found one yet, and you find one and you're not sure if it's appropriate, just let me know, okay? And email me or something and ask me. But otherwise, we're writing a summary, right? Just a basic summary. All right, you guys are good? We're going to move off this now, guys. You guys are all good? Yeah, let's move on. 7 articles. Okay, moving on. Chapter 6. Yeah, what'd you say? Yeah, I'll put that up by tomorrow. Yeah. Chapter 6 will be up by tomorrow. What I wanted to do is at least do a case study for chapter 5, and then I was going to intro kind of chapter 6 a little bit today. But even if we don't have time, I'll have that up by tomorrow, okay? I believe, let me pull up, I'm also gonna pull up Moodle, because we have a quiz on chapter 5, 6. When do I have that scheduled for? Friday. Yeah, that it's due by end of the day Sunday, right? That you guys are doing that on your own. So yes, so chapter 6 will be up by tomorrow to give you guys time to do that quiz. But I want you guys to be able to review it, do the quiz, then we can entertain questions, you know what I mean, next week, and then start that next chapter. All right, guys. Can you guys, everyone should mute themselves unless you have a question. Anyone have a question about poster topics or the journal articles? We're going to move away. Any other last questions? Go ahead.
Okay.
Go ahead.
Can I go? Or no?
Yeah.
I don't know.
Oh yeah, shut that off, please. You got an echo. Go ahead.
So essentially, I remember that Tosh asked something about the leptin thing, and after watching your PowerPoint, or your lecture, I kind of was confused on the same part. Like, do we or do we not need to know the mechanism, like the further mechanisms after, like?
You don't need to, yeah, you don't need to know the further mechanisms. Listen to the recorded lecture from Monday's class, because I clarified that again then too, so it's in there.
No, I did. That's why I just wanted to like triple check, because then you said something about like mechanism questions on the exam using leptin, and I didn't understand what you meant by that.
meaning like, you know, as long as we kind of understand what the main effects of leptin are, right, and the target. So I mean, I kind of kept it as whatever's in the notes on that slide. Remember we went over that? The fact that leptin is produced by the adipocytes, right, and that its target is where? Arcuate nucleus of the hypothalamus, right? And then what does it do? So once leptin, like what are the effects of leptin in the hypothalamus, in the arcuate nucleus? What does it do for appetite, right? Suppresses appetite. And then the further mechanism was kind of shown in that bottom of that figure and brought in a whole bunch of these other mediators, right? Yes, thank you. These other peptides and these other mediators that are essentially activated inside the target cells of the arcuate nucleus. You don't have to worry about those mediators, okay? Does that help? So the idea is we just want to know that leptin binds to its targets in the arcuate nucleus to suppress appetite. Like I said, the other things that are kind of on the bottom, that's showing you some of the signal transduction kind of pathways that are activated inside the target cell. And I think that's beyond the scope of this class. So you don't need to know that. However, I guess if on an exam, I think this is what I was trying to get at, right? Like if I said, all right, here, I explained something, or I put a figure up and I said, you know, leptin binds to this neuron in the arcuate nucleus, right? And then say this other peptide is increased or something like that, right? Which then leads to this. I would outline the pathway and say, what would happen if, say, this peptide wasn't around or something like that, okay? But I don't want you, so it would be something that you could answer just based on sort of understanding what that figure was showing. It wouldn't be anything that I would expect you to have memorized or know ahead of time, in other words, okay? Does that help, Manuela?
Yeah, thank you.
Yeah, okay. So I think that's what I was trying to get at there. All right, so let's move on. Let's do a case study for chapter 5. Let me also just pull up, where are we here? Moodle just real quick. Yeah. Okay, so remember there is information on that poster presentation. I should have not did what I just did. Anyway, the guidelines are there, the rubrics there, there's a template there for the poster, and there are 2 sample posters there, okay? But let's look at chapter 5 case study. So quiz on chapter 5-6 is due by the end of the day on Sunday, end of the night on Sunday, all right? I will have chapter 6 uploaded tomorrow, okay guys? Chapter 6 focuses on like substance use disorders, okay? And so there's some neurobiology in there. And then after that chapter, we move on and we start specifically talking about, I believe our next one is like electrolyte sort of imbalance, diseases sort of related to kidney function and things like that, okay? So anyway, that's next. I will also have your exam graded, okay? And you guys should be able to look on Moodle by Friday to see what your current grade is, okay? I'm supposed to submit like 3-week grades, but that doesn't go for you guys. But I always try to make sure then at all my classes at that point that your grade's accurate on Moodle, all right? So, so everything will be sort of up to date. My plan is to get it up to date by Friday. All right, so let's look at a case study for chapter 5. Oh wait, what do you guys? What class are you in? You're in anatomy and physiology.
She does a lot of chapters. I'm not even gonna lie.
Yeah, but does she do like 6 per exam? Or is it like 8? Because right now we're on 5 and we still don't have an exam yet.
All right, guys, let's take a look at this case study here. Take a look. Let's see how we want to answer these questions. By the way, if I pull up like what the book writes for these answers are kind of, some of them are a little weird, but let's just at least just think about some of these cases. All right, so keep reading through that. So it says, according to the healthcare and worksite settings objectives. How is that referring to? So don't even worry about that, because I think I went to go look and then I couldn't even, I didn't even know what the heck they were referring to there. Just ignore the first part of that first question. What is a key factor for the nurse practitioner to observe in looking at Mr. Johnson's height and weight? So if you took his height and weight, yeah, right? What is the height and weight going to help you determine BMI, right? And so we talked a little bit about this in terms of like a diagnostic criteria for obesity, right? You would calculate BMI. So that's the answer they're looking for, asking in a very weird way. But that's what they're looking for there, okay? Anyone have questions about that? So again, I would probably ask you more directly if I use, a case study like this on the exam. Number 2, it says, what effect could further disease processes have on Mr. Johnson's life? So I guess we're thinking about further disease processes, meaning hypertension, right? The fact that his BMI is going to show that he's obese, okay? Maybe also it says possible diabetes. So maybe right now his glucose levels are, I think the next slide has some levels of stuff. So what do you think is going to kind of happen as he sort of progresses down this path here in terms of like things that we talked about, right? What do you got? It's saying what effect? What effect? The answer is so stupid. What effect could further disease processes have on his life? So how is it going to affect his quality of life, I guess? Think about that. I don't know.
It's so weird that you can be depressed.
Okay, there you go. That's one of them. So let me tell you what the reason why I'm pulling up this case study is because I think there's more, as we move on, it's a little bit more useful. It says the cost of Mr. Johnson's healthcare could increase. What? That makes, anyway, I wouldn't be looking for that answer, okay? So we'll just move on. All right, let's move on. Yeah, I know, I told you it's weird. All right, so now this is gonna get into a little more clinical, right? Giving you some more details here. So read this now, guys. Application.
Is the chapter 6 case study due on Monday?
It's either due Monday or Wednesday. I think Monday. All right, what do you got here? Oh, yeah. All right, well, we'll move away from this quickly too. All right, we got more. So it's giving you some, blood pressure, right?
He smokes and
Oh, so what about his BMI? What category does that fit into? This, right? We can look at our table to see what it fits into. By the way, I don't expect you guys to memorize that table, but obviously if I gave you, you could calculate BMI and tell me if the patient's obese. Yeah, something like that. So look here. Take a look at this, guys. I think this is the whole reason why I wanted you to look at this. So take a look at some of these lab results here. So let's talk about some of these. So what's C-reactive protein? Why would we measure C-reactive protein? Anyone know? What's it a marker for? Anyone on Zoom? What's it a marker for, you think? It's actually a marker for increased inflammation. Remember we talked about obesity can lead to inflammation. This is even if you went to even a GI doctor and complained of certain symptoms or whatever, and they might suspect some sort of autoimmune disease, they'll do this. It's kind of like a general marker of inflammation, C-reactive protein. Yeah, so yeah, he's got a lot of inflammation based on this one marker, right? Again, it's sort of a non-specific marker, but it indicates increase in inflammation. What about blood glucose? Are you concerned about his fasting blood glucose levels? Correct. But he's on the borderline there, right? But if he continues down this path, likely he's going to have type 2 diabetes, right? What about cholesterol? Now, what do you want to look at with cholesterol, guys? Focus on HDLs and LDLs, not necessarily total cholesterol, but again, if you got a total cholesterol panel done, it's high, then you want to look at HDL and LDL. And what do you notice here? What's concerning about his numbers? Most concerning. His LDL is extremely high. And so who cares? Who cares if your LDL is higher than your HDL? What does that do?
His arteries are like really clogged up, so he's not getting enough nutrients.
Well, potentially, right? I mean, what LDL cholesterol has a tendency to do is to start accumulating, right, in arteries, right? And so, yeah, if you have high levels of this and also high levels of triglycerides, your lipid levels are high, that is putting you at an increased risk of heart disease, right? Because again, they're going to have the tendency to accumulate in those arteries, right? So yeah, these numbers aren't good. Again, our chapter's on obesity. I definitely somewhere on the exam will put something like this up, and we should be able to explain or reason why, you know, it's, or what it means to have high, you know, LDL, right? What does that contribute to? Also that C-reactive protein. Why does that, why if the patient's obese, would you even look at C-reactive protein, right? I talked a lot about the link between inflammation and obesity, right? Or we mentioned it, I mean, we talked about this a lot, and you'll see all semester we kind of mention inflammation all the time. And then also obviously blood glucose, what does that relate to? Okay, so this is why I wanted to show you guys this case study, by the way. Not for that question on the cost of healthcare, which is so stupid. And not that it's stupid, but it doesn't really make sense given the sort of scope of the chapter. All right, so let me just see what the next, okay. I mean, now it's asking you about talking about his weight and stuff like that, okay? I'm more concerned about understanding this, right? The biology, the science, the medicine. But again, as a clinician, right, you sometimes have to think about how do you talk to a patient, right? What do you tell them? You're not gonna tell them, oh, you know what? You should be on diabetes medication, you should be on cholesterol medication, all these medications. No, what should you tell them?
Smoking.
That's right. Start exercising. Start living a healthy lifestyle, right? But there are clinicians who will be like, now here's your meds, right? Like, yeah. Or patients go from doctor to doctor because they just want to hear what they want to hear. Like, no, write me a script. Don't tell me that I'm fat, right? Like, it's true. People do that. So anyway. All right, guys. That is it. We're done, I guess. So, chapter 6 will be up by tomorrow. Okay, guys? Make sure you spend time with chapter 6. Your quiz on chapter 5, 6 is due by like 11:59 p.m. Sunday night. Then also there is a case study on chapter 6 that I assigned as well. Okay? So we'll recap chapters 5 and 6 on Monday, and then we'll talk about chapter 8. So I'll probably have chapter 8 up. I'm going to try. I'll have it up by Monday. Put it that way. Okay, so we'll have everything. The case study, yeah. I believe that case study. Did I put it as, oh, I didn't share my screen? Sorry.
Well, nobody said anything.
How come nobody said anything?
That's their fault.
It's just because we had it open.
All right, well, thank you. There's a chapter 5 case study on Thomas Johnson. Okay, I did say to make sure, let me just show you what I mostly emphasized, okay, so that we're aware, real quick before we go off, okay? See this, I'm all thrown off by the half in person and the half Zoom. Anyway. All right, right here, guys. You guys on Zoom? Probably half of you guys are probably in the kitchen eating a snack while your computer's in the other room. But anyway, this is what I pointed out, guys. Make sure you understand this and what it means and what each one of these things means, okay? That's something that I think is important from this case study, and that's the reason why I brought it up, all right? All right, guys. Sorry, you guys should have yelled at me. Hello. I can't. It's hard to man both situations here. All right, guys. Chapter 5, 6. Your journal article summary and also a case study on chapter 6. Lecture will be up on chapter 6 by tomorrow. All right, guys. I'll stay on if you guys have more questions.
Thank you.
It's up there. Next week, Wednesday, I think. I'll change the date if that's not true. Then I did. It's the date's wrong.
Wait, Doctor, we have a question.